it is not an easy task to organize any important event, but South Asian International Association for Early Childhood Care and Development, in collaboration with many leading institutions from India, Bangladesh, Nepal, Bhutan, Pakistan, Indonesia, and Sri Lanka, has taken the challenge of organizing a prestigious conference on behalf of the South Asian region. It is indeed an honor to announce the inauguration of the South Asian Educational Summit 2022, commencing from 18th to 20th June in Colombo, Sri Lanka. This program is an initiative by South Asian International Association for Early Childhood Care and Development, and it will undoubtedly pave its way to the development of pre-primary and general education in our region. On behalf of the association, may I invite one and all of you to join with us through this series of events organized right throughout and the prestigious ceremony in June. The interview today is just one among a series of events planned in advance to the summit. First, may I greet my guest for today. Namaste, Madam.
Namaste.
Mrs. Kalpana Basnet holds a master's degree in pediatrics, a physiotherapist specialized in early intervention and rehabilitation of children with physical disabilities, an advanced trainee in functional intensive training of children with cerebral palsy, founder and managing director of Special Education and Rehabilitation Center and SERC Pediatric Therapy Center. For the past 17 years, she has been a mentor as well as a therapist. So I believe that our discussion about special needs education today will certainly be fruitful. Madam, may I seek your consent to carry out the discussion? To begin with, my first question is, as we all know, the term education simply means the teaching and the learning process. But special needs education should definitely have a special definition. As an educator, how do you define special education in your context?
Special education is a education which is specially designed for a special needs children. It's when I define simply, it's a training method or different arrangements for a teaching to make them independent in different types of disabilities children.
Thank you, ma'am. A very brief introduction. Thank you so much. Moving on to the second question.
Yes.
What kind of mechanisms are available in Nepal to identify special needs children in the early stages?
So Nepal, we have pre-checkup, post prenatal, postnatal, and antenatal. So some are in prenatal. If some problems, a doctor will define this is happening. And in the postnatal, if the children is after the birth, if the children have some difficulties, like if they get admitted in ICU or ventilator or something. So we used to treat it, give a therapy for the children with even after the 1 day of birth or 2 days of birth in the ventilation. So after that, the doctor and team counsel, maybe what we did in Nepal is we counsel the parents, like if your child does not develop like a normal children, like in your community, you have to see in the community if the child is developed or walk within 1 year or your does not, then you have to go for doctor to find out what is there. Some are identified after the postnatal, in the postnatal after the birth. Some are diagnosis as like Down syndrome, or if they have physical problem like the seizure or neurodevelopment or like that. Some cases like autism or ADHD or some, some delay development, that we can find out little bit later after 1 year or 17 months. And different profession, mostly it's diagnosis by the pediatric doctors, pediatrician, in the early stage. But due to barrier in Kathmandu, in the Nepal, some comes late, like maybe after 5 years they come diagnosis. But mostly the diagnosis, the system here is prenatal, postnatal, and after the birth. If some issues, there are diagnosis before, and we use the different type of tools for identifying the different types of disabilities.
Okay. Thank you, madam.
Thank you.
When we consider pre-primary education or early childhood education, what kind of facilities are provided for special needs children in the early childhood care and development centers in your country?
For the regular children in government, we have even in here we have early childhood development centers where the child can go to school at the age of 3 years. But for the special needs children, it still needs to be have more awareness. But in special needs children, so if some early childhood daycare center have a child with special needs, so teacher will send them to a doctor, a pediatrician, go to pediatrician or doctor and find out the centers or rehabilitation centers available in the Nepal, and they will go approaches for the different center for the treatment of the special needs children in early intervention for early age.
Madam, now is this done with the advice of the parents, or is it the parents who are advised to take them to the pediatricians, or does the schools or the CCD centers do it by themselves?
Actually, it's have different things, like when the parents knows early, like after the birth of 2 days, 3 days, they get admitted in VICU or have a physical problem, the disability they can look by themselves, or after 3 months, 4 months, parents will look. So it depends upon how the educated the parents, what are the accessibilities. So in Nepal, if the parents are from the village, they have to walk 2 days to the services. It's very difficulty. Those who have education accessibility, they comes in the early stage, and some are referred by a Montessori, pre-primary center. So children will go for admission and at the age of 3 in the different private Montessori school, and even for early intervention, early education center, our governments have developed. So they goes, but the teacher will say, okay, these children have some problem. He is not like normal children, so goes. And some parents will see, oh, my child is not developed like the 1 year child, does not start walking, does not say mama, papa, maybe some problem, I have to go for a doctor. So there are the lots of reasons they go for the early intervention, for rehabilitation and special education.
Moving on to the next question, my fourth question for today's interview. Is there any special curriculum for special needs children in the early childhood care and development centers in Nepal?
For special needs for early childhood education, it is not so developed, but we have some guideline for some curriculum. It's not some booklet what we focus for the special education for the children with intellectual disabilities, like that.
Right.
And one resources we have in Nepal is, the portage early childhood portage guideline, which is the development from the 1 year to 5 years. So it's written in Nepali what the development child will source and what the teacher can do at the classrooms. So that's a good guideline for them. And we have one booklet what we can teach. That's a curriculum from our special education department from Nepal, from government. So one booklet with what we can focus for the children for educations.
Is it a must to use this same booklet when it comes to special needs education, ma'am, in your country? Like, does every preschool use the same booklet? Is it the same curriculum that they?
Actually, it's not mandatory. Maybe some organization who already knows they will use, but not such a like compulsory or mandatory. You have to use it, and I still needs to be focused to develop a curriculum. Some design the curriculum. It's similar as a Montessori or early Portes guideline. So every school should know for treating a child, they should know the development of child. So they should development of child from 1 year to 5 years. So that's, I think, everybody is applying. And regarding the special needs children, every children are special, they are different. So that curriculum does not match for them. So we have to design the approaches, treatment strategies, and teaching method for them.
Right. Thank you, ma'am. Teaching strategies that are applied to these special children are unique in many ways. Am I correct, ma'am?
Yes.
Okay. What kind of teaching methods are used in the ECCD centers for the development of these special needs children?
So in the ECDC, we don't have a lot of, maybe in one school, we'll see regular children and then the one special needs children, but they will refer to the special center. So these centers will have most of them use like Porter's guideline or developmental checklist, like that. But in Nepal and in like our centers, so we use a individual education plan. As you said, each child is unique. So we have to, it's sometimes everything's returns in the book does not applicable for each child.
Yes, exactly.
So we have to develop individual education plans. So what will happen in for children's like at the 3 age or 5 years early childhood development center, which works with the special needs. So they will have a special needs individual education plan for the special needs. There will be in a special school, there will be 10 children, but each children have their education plan. Each are learning, like for example, they are learning the math, but they are learning in different way. One is counting, so one is writing. So every children have different education, individual education plan. That is a process to work with.
Right. Let me take this moment once again to invite one and all of you to join with us to this series of events planned for everyone. Commencing from this interview today, there are so many other programs planned for everyone to join with us. Madam, moving on to the next question.
Okay, yes.
Are there any special training facilities for teachers who engage in special education?
So yeah, in Nepal, actually, we don't have a college to do a bachelor in special education, but some centers are offering a 1-year course on the special education for autism, and some will take the early childhood development or yeah, early childhood education masters or 1-year course. So actually, and in Nepal we will take will don't have a center who will give a education, not a academic education like bachelor or master, but we have a certain centers which will provide a 1-year course, 3 months course, 6 months course, like that.
Okay. Madam, now in the normal schools, like when it comes to the special needs children, the same teacher who teaches the normal children,
Yeah.
the same
Yeah,
teacher teaching the
yeah.
special needs education.
Same teacher teaches this, so still needs to be lots of development in even in our country. So same teacher will teach, and there are some institute which will give a training to the teachers to understand what is autism, how to teach them in the classrooms, what is Down syndrome. So teacher will have some training on some disabilities and their problem, but the same teacher will do in the regular.
Right. To what extent is the government of Nepal involved in this sector? And what do you think are the best practices in Nepal in comparison with other South Asian countries?
Our government is planning for inclusive school, inclusive education. So one of the things like even our country have to develop is academic course on the special education, which is not in Nepal. Like some countries have academic courses, special education for mental retarded, from autism. So that is not available in Nepal. So our government have to focus on that things. So I think will be slowly develop in our country for education, academic education for special education. And for study we have to go the abroad to do the education in South Asian country.
Right.
Yeah.
Madam, are there any special programs that are introduced by the government that are not available in other countries for this sector?
They are developing, like I said, the booklet, what they can focus, and the primary rehabilitation treatments and approaches for the teacher can do in the different schools, and then the community based rehabilitation. So that booklet they develops, which will definitely help for the children with special needs children.
Thank you, madam. Moving on to the next question.
Yes.
Are there any social welfare programs introduced for this sector in Nepal?
Yes, we have a social welfare system. So we have a categorize of the label according to disabilities. So A, B, C, D label. So A is like if they can't do anything, it's dependent most on the parents, can't go to school, they will get A, and they will get some benefit like in our countries 4,000 rupees per month for the children for social welfare.
Right.
regarding the education's material and all, so if the children is enrolled in the special school in government, our government has called it as a resource center. So in the regular school, there will be one class or two class for the special needs children. So every child can do a free education. All the special needs children can do a free education.
Right.
Also the possibilities of if they have to work for 2 days 3 days difficulties, they can stay in the resident for the 10 months. So that's also the free services that government is providing. So and then that category amount is every month the child will get in the bank. So they have to make a disability card. So card will white, red, yellow and blue. So according to the they will get a benefit.
Madam, how far do you think they have contributed towards uplifting the standard of these special needs children?
Government is working. They are also doing collaboration with the different international organization, NGOs and expertise how to improve it. But it takes a little time, little time because of our barriers, accessibilities, everything. So that's the thing. Now the government is trying. Hope after some year will develop our government will develop a good services, protocols for the special needs children.
Do you see any improvements from when compared to the past? Do you see any improvements in
Yeah.
in the present?
Yeah, actually, I already said I have worked almost 17 and 18 years in the disability management. So government has do improvement lot, providing a disability card, and easily they can get it. Before it's very difficult to make a disability card. So in our municipalities, they have a doctors which will diagnose this and which will say this category the child is. So it's easy, and then they will open the bank account and our government will put in the bank account the money for the children. And every month places our district, every district have a resource center. Now the government is planning to develop a rehabilitation center for each municipalities. Some are going on in eastern part and western part of Nepal. Right. That's a huge improvement for the children, for providing services for special needs children from government than the past.
Right. Ma'am, what is the, how do you see this from the perspective of the special needs children? Like how have they improved? How has the development of these children, how can you see that? How can you identify their development because of these programs that are introduced by the government? Do you see any improvement in this sector? Like the achievements from, if we speak about their achievements and all.
Actually, children with special needs children gets something than nothing, because if they don't have any services in the remote area village, they have to stay at home. So they can get an opportunity to study, to do education. So they can meet the friends, go to plays, and the teacher can do some activities for children. That's improved. And still now I saw the government is with the collaboration with different organizations giving a training to the teachers of the villages how to handle it, and also the some basic rehabilitation. So is much better than the past year. So still needs to improvement. Every sector have area to improvement.
Okay, thank you, ma'am. Madam, how do you identify parental support for children with special educational needs in Nepal? Are there any counseling programs or supporting programs for parents as well?
Yes. Even with the government, and then with the different non-government organization, NGOs and international NGOs, they have a program for supporting the parents, like even for the how to handle the children, or for the income generation of the parents if the parents are poor. So some organizations, even government, including giving some training so parents can generate the income, which will improve the special needs children's lives also. And there are some parents organizations for the intellectual disabilities, for autism, for the cerebral palsy, for Down syndrome. So a group of parents open centers, and the parents will get a training for different NGOs and INGOs and government, how to give education, how to rehabilitate it. So that's also is developing now a lot than the past years.
Okay. Moving on to my next question. Do you think the special needs education sector in the South Asian region needs a new vision? If so, what proposals can you suggest and how can we support collaboratively?
In South Asian education, what I found working in Nepal is the government have, I don't know what's in other countries, but I feel early intervention is much better.
Yes.
So we have to increase the awareness and early intervention center, even for special needs children. So early intervention is just a magic. So maybe if we South Asian all countries focus more on early intervention, and after our next generation, we'll see a less disabled person. So if you do early intervention, it will reduce the government resources, government finance for spending for the children. If I think that's some more suggestion for. And what we can improve is vocational training. Those like for next generation, from tomorrow we'll focus more on early intervention, so we can make a decrease the number of disabled person in Nepal or South Asian country. And other things what we can do for the last years or who are already grown up. So maybe we can focus in collaboration to improve a vocational training or income generations part, so they can be a productive member of society, not as a burden for family member or so productive member. So that's the two things is most needed to improve.
That's a very important idea that you shared with us, ma'am. Moving on to my last question for today's interview. I feel that the mindset of the teachers and the parents will travel a long way in molding the personality of these special needs children. So how would you finally, what advice would you give to teachers and parents of these special needs children in building a full-fledged individual?
Actually, both the parents and teacher have to work in collaboration together. So in point of view of professional, we don't have to look, okay, person come, his hand is not working, his leg is deformed. So we have to see what's our parents needs, because if the child is can't speak, can't express, so we have to know what's the parents needs. So teachers should know the parents needs, so then teacher can solve most of the things parents is have difficulties. And teachers should have collaboration with the parents, and parents needs training what to do at home. This maybe if the eating is for example, eating is a goal, and that he have to be child have special needs child have to be eating independently. So teachers and parents have to make a goal together. okay, I'll do focus on eating on the lunch, but you have to focus for dinner. So it's not like, both have to work together. If teacher focus on eating by training for to teach student, and if the parents fails, mother or parents fail, then the children will never learn. So both have to be collaborated and share works together to achieve the same goal and what is needed for the children. So then we can improve the special needs children quality of life, making them education, mostly making them independent in their life.
Yes, madam. Now there can be parents who are not ready to accept the fact that their child is a special needs child.
Yeah.
But yes, how
So
could we approach those parents?
I think this is all over the world. This have a problem. So some child is mild, some child is severe. So some parents with the severe children, they will accept, okay, my child have a problem, but the child with the mild disability says my child don't have a problem. Bigger thing in the awareness is we have to counsel the parents for acceptance. We discuss on early intervention. If the
Yes.
parents accept it in the early age,
Yes.
then after 5-6 years, 4-6 years, he will be in regular schools, he will be independent, everything. Then acceptance is not needed. But in the early intervention, acceptance is needed. So more counseling is needed. Counseling, we have to show the parents, you have to define what the category of disability is, what level the child is, what problem he is having, what he will have in regular school. If he go in early stage, maybe your child will be able to do this some years, after some years. So we have to clear the parents about problem, disabilities, and the future of the child.
Okay, thank you, madam. As we have come to the end of our interview today, let me take this opportunity to thank Madam Kalpana for accepting our invitation and joining with us today amidst her busy schedule. Thank you, madam. Thank you so much for joining and sharing your knowledge and your expertise in the field of special needs education. Hoping to see you at the summit.
Yes.
Thank you so much.
Yes.
Have a good day, ma'am.
Thank you for giving me this opportunities, Tanya and Janakaji. Thank you for sharing the special education system in Nepal. Thank you for giving this opportunity to me. Thank you very much.